Types of mental illnesses. A mental disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. It is usually associated with distress or impairment in important areas of functioning. There are many different types of mental disorders. Mental disorders may also be referred to as mental health conditions. The latter is a broader term covering mental disorders, psychosocial disabilities, and other mental states associated with significant distress, impairment in functioning, or risk of self-harm. There are many different conditions that are recognized as mental illnesses, and we will introduce some of the most common mental illnesses and other illnesses that are less common. But before that, remember to like this video, leave a comment after watching, and subscribe to our YouTube channel. Let's get started. Common mental illnesses. Number 1. Anxiety disorders. People with anxiety disorders respond to certain objects or situations with fear and dread, as well as with physical signs of anxiety or panic, such as a rapid heartbeat and sweating. An anxiety disorder is diagnosed if the person's response is not appropriate for situation, if the person cannot control the response, or if the anxiety interferes with normal functioning. Anxiety disorders include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Number 2. Mood disorders. These disorders, also called affective disorders, involve persistent feelings of sadness or periods of feeling overly happy or fluctuations from extreme happiness to extreme sadness. The most common mood disorders are depression, bipolar disorder, and cyclothymic disorder. Number 3. Psychotic disorders. Psychotic disorders involve distorted awareness and thinking. Two of the most common symptoms of psychotic disorders are hallucinations, the experience of images or sounds that are not real, such as hearing voices, and delusions, which are false mixed beliefs that the ill person accepts as true, despite evidence to the contrary. Schizophrenia is an example of a psychotic disorder. Number 4. Eating disorders. Eating disorders involve extreme emotions, attitudes, and behaviors involving weight and food. Anorexia nervosa, bulimia nervosa, and binge eating are the most common eating disorders. Number 5. Impulse control and addiction disorders. People with impulse control disorders are unable to resist urges or impulses to perform acts that could be harmful to themselves or others. Pyromania, or starting fires, kleptomania, or stealing, and compulsive gambling are examples of impulse control disorders. Alcohol and drugs are common objects of addiction. Often, people with these disorders become so involved with the objects of their addiction that they begin to ignore responsibilities and relationships. Number 6. Personality disorders. People with personality disorders have extreme and inflexible personality traits that are distressing to the person or cause problems in work, school, or social relationships. In addition, the person's pattern of thinking and behavior significantly differ from the expectations of society and are so rigid that they interfere with the person's normal functioning. Examples include antisocial, obsessive-compulsive personality disorder, histrionic, schizoid, and paranoid personality disorder. Number 7. Obsessive-compulsive disorder, or OCD. People with OCD are plagued with constant thoughts or fears that cause them to perform certain rituals or routines. The disturbing thoughts are called obsessions, and the rituals are called compulsions. An example is a person with an unreasonable fear of germs who constantly wash their hands. Number 8. Post-traumatic stress disorder, or PTSD. PTSD is a condition that can develop following a traumatic or terrifying event, such as a sexual or physical assault, the unexpected death of a loved one, or a natural disaster. People with PTSD often have lasting and frightening thoughts and memories of the event and tend to be emotionally numb. That's it for our most common mental illnesses. Let us proceed this time to the less common types of mental illnesses. Number 1. Stress response syndromes, formerly called adjustment disorders. Stress response syndromes occur when a person develops emotional or behavioral symptoms in response to a stressful event or situation. The stressors may include natural disasters, such as an earthquake or tornado, events or crises, such as a car accident or the diagnosis of a major illness, or interpersonal problems, such as a divorce, death of a loved one, loss of a job, or a problem with substance abuse. Stress response syndromes usually begin within 3 months of the event or situation and end within 6 months after the stressor stops or is eliminated. Number 2. Dissociative disorders. People with these disorders suffer severe disturbances or changes in memory, consciousness, identity, and general awareness of themselves and their surroundings. These disorders usually are associated with overwhelming stress, which may be the result of traumatic events, accidents, or disasters that may be experienced or witnessed by the individual. Dissociative identity disorder, formerly called multiple personality disorder or split personality, and depersonalization disorder are examples of dissociative disorders. Number 3. Factitious disorders. Factitious disorders are conditions in which a person knowingly and intentionally creates or complains of physical or emotional symptoms in order to place the individual in the role of a patient or a person in need of help. Number 4. Sexual and gender disorders. These include disorders that affect sexual desire, performance, and behavior, sexual dysfunction, gender identity disorder, and paraphilias are examples of sexual and gender disorders. Number 5. Somatic symptom disorders. A person with a somatic symptom disorder, formerly known as a psychosomatic disorder or somatoform disorder, experiences physical symptoms of an illness or of pain with an excessive and disproportionate level of distress, regardless of whether or not a doctor can find a medical cause for symptoms. Number 6. Tic disorders. People with tic disorders make sounds or display non-purposeful body movements that are repeated, quick, sudden, or uncontrollable. Like sounds that are made involuntarily are called vocal tics. Tourette's syndrome is an example of a tic disorder. Other diseases or conditions, including various sleep-related problems and many forms of dementia, including Alzheimer's disease, are sometimes classified as mental illnesses because they involve the brain. And that's it for our most common and uncommon mental illnesses. Always remember, people with mental disorders also require social support, including support in developing and maintaining personal, family, and social relationships. People with mental disorders may also need support for educational programs, employment, housing, and participation in other meaningful activities. Thank you for watching this video. Before we let you go, don't forget to leave your thoughts in the comment section below and subscribe to our YouTube channel. We can't wait for you to join us still on our upcoming videos.